We probably never think about breathing except when we have trouble doing it. That's why every October, the American Lung Association celebrates Healthy Lung Month. ABC 7 medical contributor Dr. Ogechika Alozie with Sunset West Health joins me now to discuss taking care of your lungs. And doctor, when it comes to lung disease, most people probably think of lung cancer, COPD, asthma, which I happen to have.
Okay.
But break down the numbers for us about lung disease.
Yeah, so a lot of things that are happening with lung disease. So you mentioned the big ones, right? Whether it's cancer, whether it's COPD, which is chronic obstructive pulmonary disease, asthma. As a kid, I had asthma, right? A lot of people have breathing conditions. I think what's important to know is that we focus on cancer, and that is important. We've talked about screening for that. But about 87% of those cancer deaths come from smoking. So there's a lot of things you can do, but it's not just cancer, right? It's pneumonia, it's getting viral infections, right? We're coming into that flu season, RSV for kids. Obviously, COVID is not gone. And even tuberculosis, right? So as an infectious disease doctor, I still see a lot of people that have TB.
What are some of the things people can do to protect their lungs?
I think the biggest thing you can do is not smoke. Either not smoke or do not smoke. I think keeping your house clean, right? A lot of times we talk about dust and mites and molds, right? If you have a lot of humidity in your house, a lot of people keep their house warm, which is fine, and it's getting colder, but it's also important just to keep your house with a humidity that's below 50%.
And the symptoms that people should not ignore include shortness of breath, chronic cough, chronic chest pain, chronic mucus production, wheezing, of course, for asthmatics.
Absolutely.
And coughing up blood, which is a serious
You know, so that is a danger sign, right? So if you ever cough up blood and you haven't had some sort of facial trauma, that's a danger sign and something that you should talk to your physician immediately about. Some of the other things we don't think about, right? That shortness of breath, that chronic cough that you may have, especially if that cough goes along with mucus, you probably need to look into that and get an x-ray or something else as well.
Okay, now we're talking about Healthy Lung Month. When you say make your home smoke-free, that really means
don't smoke.
Don't smoke.
That's the baseline and sort of bottom line of that. But again, like I talked about, right, a lot of times in older homes, they may not have the right circulation. They have a lot of mold, right? People that are asthmatic or have respiratory disease may be allergic to things. And so you need to figure out, well, what am I allergic to? Is there something do I need to rip out my carpet? A lot of times people have carpets in their homes for years and don't realize it's the carpet that's making them sick. And then, you know, when you're doing cleaning, and whether it is using Fabuloso or whatever it may be, try to get those that have a lot more natural ingredients, because those chemicals can irritate your nasal passages. They can cause something called postnasal drip, and that can all lead to a lot of coughing and a lot of shortness of breath.
Postnasal drip, one of my favorites in wintertime.
Absolutely.
Now, let's talk a little bit more about quitting smoking.
It's hard.
It is hard.
It's hard.
If you quit with your last cigarette, you can actually start feeling some improvement
within 24 hours. And so as somebody that did smoke in college and has smoked as an adult before, I understand it's not easy. I do help people try to quit smoking, whether it's Nicorette gum or a patch, but it is very important. Even if you stop today, by Monday, you'll start to feel better and your lungs will start to repair themselves. So the number one thing you can do if you have lung disease or you want to avoid lung disease is not smoke or stop smoking.
And let's take a look at the local resources that are available for lung health here for all of our viewers. Of course, a smoke-free Paso del Norte is there to help you try to stop smoking. And if you need help, Providence Hospital has their pulmonology department and their lung cancer screening program. They're all available.
Yeah, I'll say one thing about that. If you have smoked for more than 10 years, it is important to talk to your physician about getting a screening. There's a screening test, it's a CT of your chest that actually show early changes in your lungs that you can intervene on and potentially protect yourself from getting lung cancer in the future.
ABC 7 medical contributor Dr. Ogechika Alozie, as always, thank you very much, sir.
Thank you, sir.